what mental health conditions have you seen improve with LDN?
I talked about the depression and the anxiety earlier. I definitely think there has been a lot of benefit that I've seen with that. And I think it's underused, honestly, for that.
Yeah, I've seen it used in PTSD, depression, anxiety. Sometimes it can cause a little bit more anxiety, and that's when you know maybe the dose is a little high, so you can drop it back down and then their anxiety goes away. But generally, for those mood disorders, I see it like twice a day versus things with autoimmune, which might be once a day at night or in the morning. With mood, I see mood disorders, I generally see more one or twice to maybe 3 times and a little bit higher dosing.
Yeah, I mean, even 4 times a day for mental health. I don't know whether you can remember, Sam, at one of the conferences, we had a Dr. Wipper Pap. She was from Germany, and she'd written a paper about dissociative syndrome,
Yes,
which was really fascinating, and how it wasn't a quick fix. It took a long time to, stabilize a patient so they didn't have that issue. But it was really very effective, which was pretty amazing.
Yeah, and in each of the LDN books, it does talk about mood disorders a little bit, and there's chapters because it's not the traditional dosing that you think of with LDN. It is slightly different. So it is kind of separated, I think, from immune support or, the autoimmune types of diseases. And then it's like mood disorders and a little bit higher dosing and multiple times a day. So it is kind of a different thought process there.
And talking of multiple dosing, Dr. Norman Marcus from Cornhill, and he's got his own clinic in New York, isn't he? And he actually has his own protocol where he uses 4 times a day dosing. This is for chronic pain, and he does it very slowly, but the same dose over 4 doses in one day. And he swears by his protocol of getting people off pain, which is really good.